He reassured me that we were going to get her back to a normal way of living and that she'd be able to do sports and dance and her hiking and her biking and everything again. My name is Samantha Eppley. My daughter Cheyanne was diagnosed at age 4 with hip dysplasia. She later had it corrected at Robert Wood Johnson University Hospital in New Brunswick at the age of 12. In the beginning, she was just a normal, active child. Occasionally she would say, oh, my legs hurt or something like that. It didn't really start getting worse until she was probably 9, 10 years old, and then over the next couple of years it just got really bad.
It's hard to describe and to put into words how I was feeling, but it was like an excruciating pain constantly.
I found Dr. McPartland after I started working for Robert Wood Johnson University Hospital in New Brunswick. I actually worked in the pediatric ER, so the amount of kids that we've seen come in with broken bones, we were always referring them to him and his practice.
When I first evaluated Cheyanne, the most important thing is to listen to her and really understand, how this impacts her and then what her specific complaint is, and then target your exam and your workup to that complaint.
He actually watched her walk to the exam room, and he could tell that her legs just did not line up the right way.
What we found when I just first looked at her x-rays was that the hip looked as if it was being overloaded. And you can see that by some whitening of the area around the hip. The typical way you look at depth of the hip looked normal on her x-rays, but there was something else abnormal going on here. And so we took advantage of a special protocol MRI that we use. And what we found is that her insufficiency was not in the classic location of the hip. And this is something that doesn't come along very frequently.
He told us that no amount of pain medication was going to help her, that the way that we had to fix this was going to have to be surgical.
I felt relieved once I knew that I could get it fixed and I wasn't going to have to live with it for my entire life.
We cut the pelvic bone in 3 places in a complex way, here, here, and here. And once we free the hip socket, we can reorient the socket so that it can be in the proper positioning and then stabilize it there with some screws until the body heals. And now we've corrected the coverage of the hip and corrected her insufficiency.
I feel amazing. I can move, I can do so much more physical activity without having pain. Like last night I went to practice, and practice is between 1.5 hours to 2 hours maybe. And then I went for a run around my whole block. I was tired, but I had no pain.
She's like a whole new person. She's back to being her normal self. She's so much more active, and I'm so grateful for that.
This is a really impactful type of surgery. It's incredibly satisfying to see someone do well. We don't want to over-celebrate any one success because they're all important, but it means a lot to see a kid who's really got a smile on their face and back and active again.